Dr. Eswaran, we talked about medications, and we talked specifically about diet as a non-drug treatment for irritable bowel syndrome. What are some other non-drug or medication treatment options for patients with IBS?
Thanks, Dr. Shapiro. As we mentioned in the previous videos, irritable bowel syndrome is not the same for everybody. Some patients will say, okay, stress and anxiety is really driving my IBS symptoms. Some patients will say, what I'm eating is really exacerbating my IBS symptoms. And some patients just say, I don't know what it is. It's just a bad day. And so having a good conversation with your provider and trying to figure out what some of the drivers for your symptoms are, I think can be really helpful. Many times stress and anxiety can increase a patient's symptoms, and even anticipating your symptoms can increase your stress and anxiety. So when we think about non-medication treatment options to help decrease symptoms, especially in a patient who can identify that stress and anxiety makes their symptoms worse, we can kind of use that not just for helping the patient understand, but actually use that driver, that increased mind-gut interaction as therapy. So using hypnosis, for example, or cognitive behavioral therapy, mindfulness with either an app or a GI psychologist can be very, very effective, both in the short term, but also in the long term. So going through these treatments with some of those modalities I discussed can be helpful in that moment or during that treatment time, but also after those treatments are concluded, we can see those benefits for many months or years down the road. And so if you are noticing that your symptoms are exacerbated by, the stress that you're undergoing, then, let your provider know that because that may be an opportunity for treatment, an avenue for treatment for you. There are also a lot of over-the-counter options for irritable bowel syndrome that are marketed, probiotics, many supplements that our patients will talk to us about. And many of them do have some data to support their use. Peppermint oil, for example, is an option. Fiber is sometimes used for irritable bowel syndrome. But keep in mind that many of the claims that are being made by the manufacturers of these supplements may be helpful, but they also may exacerbate your symptoms or be very unhelpful. So it's just important to talk to your provider about if you are considering trying one of these supplements, that there's a conversation there.